Hi, so today we'll be talking about the total knee arthroplasty. It's a surgical procedure in which the parts of the knee are replaced with artificial prosthetic parts. And the most common reason for this knee replacement is to relieve severe pain caused by osteoarthritis. So most times these people will be in a lot of pain, limping, joint dysfunction, and it'll become so severe that the individual's daily living is affected and the non-surgical therapy is not providing enough relief, so surgery is our next option. Position and safety precautions. So our patient will be in supine with leg positioning devices. Depends on the surgeon's preference. And then we'll place paddings under bony premises. We'll place a donut pad placed under the head, pillows under the lumbar curvature and knees, and then we must avoid letting the feet be in plantar flexion because it can cause a stretch injury. And then safety belt is secured accordingly, and egg crate foam pads to avoid pressure injury to skin, blood vessels, and nerves.
Okay, so for my part, we're going to be going over prep boundaries, which is going to start at the knee joint and extend upward to the lower border of the tourniquet, and then the entire leg and foot. A foot holding stand may be used when performing skin prep, or the circulator, somebody that's not scrubbed in, sometimes will just hold the leg up as well. Drapes in order of use. The operative leg is going to be raised by the circulator, and a 3/4 sheet is placed under the leg on the OR table. A sterile towel is wrapped around the lower edge of the tourniquet and held in place with penetrating towel clamps. Toes of the foot go in a stockinette, which is then unrolled down the leg, covering the sterile towel. A split sheet is placed along the lower border of the thigh tourniquet, with the split end of the sheet going towards the head, and then an extremity drape is placed last. The anatomy that could be involved is going to be your patella, your tibia, patellar tendon, meniscus, and your femur.
Okay, so this procedure is basically a prosthetic replacement of diseased surfaces of the femur, tibia, or patella. We typically call this procedure just a total knee replacement. That's probably the most common name that it goes by. And 3 examples and supplies that we might need for this procedure. We talked about all of this in class, and it's going to be the power oscillating saw and cord, a basic orthopedic tray, pulsed lavage suction irrigator and tip, osteotomes, screwdrivers, everything that you're going to need in an orthopedic procedure. Some risk factors that come with this is severe infection. That is the number 1 risk factor whenever it comes to a total knee replacement, or a total replacement of any kind. It's going to be infection. That's why it is super important to be strict with your sterility when it comes to these cases. And with the infection, you could actually lose that limb. So the person, if it got deep enough or bad enough, they could lose their entire leg due to this infection. Pulmonary embolisms, that's basically a blood clot, and they can actually be life-threatening. And then ligament, artery, and nerve damage. This could cause pain. It can restrict your movement and stuff like that. So there's plenty of risk factors that come with this procedure. It's a very extensive, complicated procedure that takes a lot. And our question for you is, what is a more common name for this procedure?